Good evening, everyone. We are so honored to have you join us this evening for our special Meet the Team webinar. Just to give you a quick rundown on how things will be laid out, each one of us, starting with myself, will introduce ourselves, our position here at the Stanford Children's Health Celiac Disease Center, and what our job means and what we do. The point of this hour really is to support our community. We are giving you this opportunity to ask any and all questions you may have, both about us or celiac disease as a whole. And the goal of all of these webinars is to help you to lead the best lives that you can, provide you with resources and opportunities to ask and learn. So I'll kick off the evening. My name is Hillary Jericho. I am the medical director of the Stanford Children's Health Celiac Disease Center. What that means is I'm the one in charge of helping to create and execute so many of these events that we have for you. Of course, a team does not involve just I, as I'm sure you've heard. All these people that you're going to hear from tonight are what make it possible to get all these events off the ground from you, from our peer-to-peer program to these webinars to our new in-person gatherings. It is this team that makes it possible. We work to create opportunities for you in research, providing the best medical care we possibly can to help you, educational events, fundraising, working to raise money to have all these events go forward into the future, and marketing. So trying to get the word out. If any of those areas you think you can help or support us and are interested, please reach out anytime. We'll have emails posted along the way as to how to get a hold of us. All right. With that, I'm going to turn it over next to one of our psychologists, Dr. Anava Ren, to introduce herself and then pass it off to whoever she'd like. Thank you.
Ms. Anava Larry just mentioned, and I'm the psychologist on our celiac team and our IBD team. And I spend most of my time in clinic and doing clinical work. So I work with patients, so kind of our younger kiddos in our celiac clinic to our elementary and middle school age, high school, all the way through young adult, college and beyond, and really work in all sorts of reasons I might meet a family. So it might be around a new diagnosis of celiac, starting a gluten-free diet, might be kiddos who are teens or young adults who are having a little bit harder time adjusting to a diagnosis or adjusting to a new diet and lifestyle, struggling a little bit with different emotions that might come up around this. And so providing support and treatment around that, and also helping find support and resources in the community as well for mental health. And then I do a lot of research with Hillary and the rest of the team as well. So we've been doing a lot of work around peer mentorship and connecting youth who have celiac to other youth to help just psychological and social well-being, and also really involved in community events that our center puts on. So many of which Hillary is running and doing some really wonderful things just, again, to connect our community members and to build our celiac center and our community. So with that, that's a bit about what I do. I will pick, let's see, who's about Allison. Maybe I'll have you go next.
Great, thank you. I'm Allison Borman. I'm the nurse practitioner for the celiac program. I've been here for a little over 4 years now. Mostly I'm in clinic. I follow patients similarly to Dr. Jericho and Dr. Kavari. I also help lead our interdisciplinary clinic, which is a very special clinic that I think we're all, thrilled that we can offer with this program. And I will pass to Farah.
Hi everyone, my name is Farah Mardini. I am a registered dietitian for both celiac disease and IBD, inflammatory bowel disease. What I do is I really talk about food all day. That's all I think about, that's all I do. And then after work, I do that some more. But I'm in clinic most days, just providing education, counseling about nutrition, how it can affect somebody's health and growth, all while maintaining a healthy relationship with food. And so, yeah, that's really what I do. I will pass it on to Ali.
Hi all, I'm Allie, one of the clinical research coordinators at the center. I work a lot with the IBD side on studies, but I also work on some celiac. Um, the day-to-day can range. We do a lot of regulatory work, admin work, as well as conducting the studies themselves. Um, and so it's been wonderful working with the whole team, connecting all the different sides, working with Dr. Jericho to work with you guys.
I can go next.
Okay, I was
yes,
going to tell
passing
Allie
it
she had
off.
to pick the next person.
Passing it
It's
off to
all good.
Marielle then.
Great. Hi, everyone. My name is Marielle Gibson. I'm a life science research professional in Dr. Rosen's lab, and that's where I manage the pediatric IBD and celiac disease biorepository. So that's where participants, like we get research samples from them, and then collaborators at Stanford University can do research on Crohn's disease, ulcerative colitis, and celiac to try to find cures and treatments for these conditions. And I really work really closely with our clinical research coordinators as well as our scientists, and it's really a great team. So with that, I will pass it to Picha.
Thanks. Hi, everyone. My name is Picha Soxini, and I am also a clinical research coordinator. You may see us in clinic or maybe see emails or MyChart messages from us telling you what research studies are eligible for. And on top of coordinating research studies, we're there to support our providers and making sure the studies are running properly. And we're also there to support our participants and making sure they feel supported and are well informed about the research studies going on at our center. And I will pass it off to Ashley.
Hi, everyone. My name is Ashley Dunn. I'm the program director for our center, so I work very closely with our faculty here on the call, and as well as the clinical staff and our research coordinators, and really just executing the mission and vision and doing some strategic planning. I supervise our clinical research coordinators and really help lead our research studies and help co-create studies with Dr. Jericho and Dr. Wren in a lot of our work. We really want to hear from the celiac community to make sure that our research not only resonates with our families and our participants, but also just has hopefully in the future profound impact. So we love interacting with our families and patients. And then we also help oversee and coordinate all of our IBD, our inflammatory bowel disease, and our celiac community events. I will popcorn it over to Leah.
Hi, everybody. I'm Leah O'Leary, and I'm an admin at the center, and I support not only Ashley, but Dr. Jericho, Dr. Wren, and Dr. Moses. This center has a special place in my heart because I myself have celiac, and so do my 3 kids. So if you have questions about your kids, camps and food and all that kind of stuff on a more personal level, I can help you answer those questions. With the center, I also help coordinate seminars and symposiums and things like that. So pretty busy all the time. So welcome. And I will popcorn it to who is left. Dr. Rosen.
Oh.
All right. Good evening. Excited to be here and excited to see everyone and those on the call. I'm Michael Rosen. I'm a pediatric gastroenterologist, and I am have the privilege of being director of the Center for IBD and Celiac Disease. And that our center encompasses outstanding leading edge clinical care and also research. So I oversee at a high level those activities, and in addition to the clinical care, also meet some on our team are care quality improvement efforts. I'm relatively new. I don't know, maybe this is the last time I can say that. Relatively new to the Bay Area. About 3.5 years ago, I moved here to work with this incredible group. And I also run a lab and research program where we one of the things we do is we can generate little mini guts in a petri dish from the tiny little biopsies from patients to study disease processes and work to develop better treatments. So I will end it there and I will popcorn it to Hammy.
Hi, I'm Hammy. What is my title? Analytics and Clinical Effectiveness Specialist. I never use it, so because basically I just analyze data to identify any gaps in care and making sure the care that everyone gets is equitable. And I work really closely with people like Caroline, so I will pop it over to Caroline.
Thank you. I'm Caroline Chris. I'm a quality improvement advisor. I've been working with the center for about a year and a half now. I also support the IBD Center as well. And I work with Amy on projects where we just are really focused on improving the quality of care that we provide to our patients. I will popcorn it to Anuya.
Hi everyone, I'm Anuya. Sorry if my computer's a little laggy, my connection's not the best. I'm a clinical research coordinator. I'm relatively new to the center. I started in September, so I'm not super involved in the celiac space, but that's something I'm excited to do these next couple months. I will popcorn over to Hannah.
Hi, I'm Hannah. I will echo everything that Anuya just said. I started in September, so I'm just kind of joining the team and excited to do so and get more involved in the celiac side of things as well. I have a not fully diagnosed celiac, but likely, and so that's kind of what brought me to this lab, is some chronic GI problems. So just kind of understanding from that personal side and excited to, support all of you.
I think Dr. Kavari is still left.
Last but not least.
Hi, I wasn't sure if I was going to be forgotten. I was like, do I? I'm Naseem Kavari. I'm one of the pediatric GI doctors that has the privilege of working with this amazing team, as Hillary mentioned earlier. And I am mostly in clinic, so I get to see families and children most days, which is great. And then in addition to celiac, I love kind of allergy and the combination of allergy and celiac together. So those are some of my favorite things to think about. But one of the things I love about celiac, other than the fact that I have a few close friends that have celiac, is just how much better people can feel once they're on the gluten-free diet. And so it's a very sort of fun place to be to watch that transformation with families. And I think Carolyn, Carolyn, you went already. Is that right? Okay, Allie, yes, everyone went. I was seriously last.
Yeah. Anybody we missed?
Everyone.
I don't think we missed anyone, but I was going to make a little plug for Svati, our medical assistant.
Yes.
Is not here, but surely all of our families have interacted with her, and she certainly keeps us all together. I'm sure it's like herding cats.
I'm sure. And also our two amazing nurses, Leah and Lisa, who I'm sure many people have interacted with as well. All right. Well, thank you guys all for those amazing introductions. And I do have a little fun true false game if our audience doesn't have questions, but I'd like to just open it up right now. Really, this is your hour, your opportunity to ask any and all questions that you have in your mind. So I welcome people to unmute. Feel free to speak up, put things in the chat. I'll give it a little bit. And if I don't hear from anyone, then I'll jump into my game instead. All right, I guess I'm jumping into my game. Well, if these my questions stimulate any questions from you guys or you want to hear more on them, feel free to speak up. All right, so I'm gonna share little backgrounds on a handful of the members on our team here today. And I have my little sheet here. And the game does not just apply to our participants, but also our panel members. So I'd like everybody to speak up or put your answer in the chat. Let's see who can get what right. So I think, who should I start with?
And just
Okay.
for clarification, Hillary, Dr. Jericho, are we saying that these blurbs are true
Yep.
or false?
Oh, I apologize. Thank you, Hannah, for bringing that up. Yes. So all of these statements are going to be true or false. So people need to guess if they're true or false. And then the person the statement applies to will need to speak up and share if this is true or false. If it's true, we'd love to hear a little bit more about it. If it's false, please fill us in on the true statement. So just because she has the coolest background, I'm going to start with our dietitian, Farah Mardini. All right. So here is a statement, and you have to decide if this is true or false. Who would have thought Farah Mardini ever indulged in unhealthy foods? As a teenager, though, her sweet tooth led her to sneak desserts until severe food poisoning from raw cookie dough landed her in the hospital. This experience opened her eyes to the importance of healthy living, motivating her to prioritize not only her own diet, but to help others do the same. So everybody on the call, with the exception of me, because I know the answer to all of these, please put in the chat or feel free to unmute and share if you think this statement is true or false, and then we'll turn it over to her to give us the real answer. All right, so I see a couple of trues, I see a couple of falses. Give it a little bit more time, get all these responses. See a lot of people from our team. What do our participants at the seminar today think, or webinar? Let's see, anybody else want to chime in? Oh, yeah, I see a couple people from the audience. Okay, saying true. Let's see if anybody else. Oh, I see a false. I love Dr. Rosen's response. He refuses to believe cookie dough is bad as long as it's gluten-free. Awesome. All right, Farah, what is the truth?
All right, this is actually false for two reasons. The first reason is that I never stopped enjoying cookies, although I don't eat raw cookie dough, but can't stop eating cookies. I do believe in balance, and I make sure to eat a variety of different foods to feed my body and feed my soul. But the other reason is I actually don't remember ever having food poisoning. I'm saying this for the second time this week, so I hope I don't jinx it.
Awesome. All right, before moving on to the next statement, I'll just open it up to, again, our participants attending today if they have any additional questions for Farah about the gluten-free diet. Allison said, I know she loves treats. I did get a question about whether this is just specific to ped celiac. No. While we are all pediatric celiac focused, a lot of us do have knowledge outside of peds, so we're happy to try to answer any questions our audience has to the best of our ability. So if that person has a question they'd like to ask, a more general question, we're happy to try to answer that for you. All right, so I did get a question. Is sugar addiction especially an issue with celiac patients? Farah, what are your thoughts?
Tell me more. Tell me more about what you mean with like sugar addiction.
You can either unmute or put that in the chat.
Kids love sugar. I will say sometimes one thing I'll say I noticed is when somebody goes gluten-free, right, starts the gluten-free diet, we do get excited about the gluten-free alternatives, right? There are a lot of fun alternatives out there and a lot of like prepackaged foods and all of that, which are great. I think they play a good, role in there, but sometimes we might forget about the naturally gluten-free foods. So as long as we remember to offer different kinds of foods and variety, I think that's all we can do. That's something that I've noticed, and that might answer your question. If not, let me know.
Wonderful, Farah. Thank you. So there is a question about talking more about the drugs in development for celiac disease. I could certainly start with that. There are a lot of drugs in the works. They approach many different aspects of the inflammatory pathway that causes celiac. Anything from targeting what we call the tight junctions, the leakiness of the gut that lets gluten across that causes that inflammation, to some medications that are almost trying to act like allergy shots to stimulate our immune system to stop reacting to gluten in a similar manner to what is being done with allergy shots. We have other medications that will actually digest gluten and break it down so that our body doesn't react to it. And then there's other medications out there that actually work against the enzymes that cause the antibody formation and the inflammatory process that causes celiac disease. So there's a lot of knowledge. The most important part is trying to understand the process that causes celiac. And by understanding that, you can then work on targets to I don't know, attack's not the right word, but to focus on those different aspects of that process of inflammation to try to block it. So there are a lot of medications out there. Unfortunately, nothing is available as of right now. Many of them are what we call in clinical trials and moving along. But at this point in time, the key is to find a medication that's safe for patients, that reduces the inflammatory response, and also limits the symptoms the patient has. And there was a medication that we were very hopeful about called Nexvax a number of years ago. It seemed like it reduced the inflammatory process, but then unfortunately, patients were still very, what we call clinically symptomatic. They had a lot of symptoms, which obviously is not going to be ideal. So we are in the works here at Stanford, similar to Dr. Rosen's model. We have a PhD, MD in the lab. His name is Dr. Kuo, and he has that same mini intestine that he looks at in a petri dish, but it's specific to celiac. And so we are looking into the process of that inflammation, what drugs can help. So both on the adult side with Dr. Nielsen Fernandez Becker and us on the ped side, whether you're an adult or a pediatric patient, you all can help further this research. To make these organoid models, we rely on our patients' generosity to donate some of their biopsies, extra biopsy samples during a scope, which really poses very little additional risk. But that helps to create these models, which will help to further research. So we're very thankful to all of our patients that have been able to contribute to that. Please let me know if that answered your question enough, or if anybody else on the panel would like to chime in, please unmute and add anything additional.
Actually, so hi, this is Sarah. I'm the one who asked the question.
Yeah.
So could you talk a little bit about, and maybe I'm in drug development, so I know a little bit about it, but I mean, just from the stage of development, like, can you talk a little bit about, is anything actually in phase 3 at this point, which would be, sort of closer to something that might be approved? Or do you think that are most of the drugs still in very early stage clinical trials where it's like mostly safety?
No, there are drugs certainly that are in the phase of clinical trials where we are using them in the human, like the true human model. Unfortunately, not in pediatrics as of yet. Our partner, Dr. Nielsen Fernandez Becker on the adult side, is involved in a clinical trial with adults, and they are working, I believe with Takeda, and they're working to start recruiting adolescents. It's on hold for the moment, but we are definitely making advancements and moving forward.
Super, thank you.
Yeah, sure, of course. All right.
Am I off mute? Sorry. Right. So I see. I did see it in look at your question. There's a pretty nice graphic on the Beyond Celiac Disease website about drugs and what stage they're in clinical trials. So I can get that link and put it in the chat.
Thank you. All right, and then I do see another question from the audience here. I've been strictly gluten-free for 1.5 years now. I've noticed neurological symptoms getting better. Would it be a possibility recommendation to see a neurologist? I'm an adult diagnosed when I was 59 after a decade of serious symptoms. I do feel clearly so much better with so many symptoms I had throughout my life. I could take that, or I could turn it over to one of my partners. I don't know if Dr. Kavari wants to address this, or Allison, or anybody else on the call. Otherwise, I'm happy to address it.
Let me just make one little
happy-
disclaimer before
Yes.
I didn't interrupt you, Nassim, but let me
Oh, that's
make a little disclaimer that in this forum we'll do our best to answer like the questions in a general sense about celiac disease or any other or medical concerns, but we're not able to give sort of personal medical advice. So I think we can answer questions in a general sense, but please don't interpret them as personal medical advice.
Perfect. Thank you, Dr. Rosen.
Thank you for saying that. That's so important. I would say maybe the first question would be if it's worth just touching base with your primary doctor and having them just think about the other things that might be associated with the symptoms that you're having. Just because there's, outside of celiac, there's always other things that can sort of cause different neurologic signs and symptoms. There is sort of some evidence about exposure to gluten in celiac patients actually producing a certain type of tissue transglutaminase that does cross the blood-brain barrier. So certainly there could be some neurologic symptoms associated with celiac. I would say typically if all the rest of the celiac symptoms are getting better, however, and you've been off of gluten for a while, it seems like I would want to be really open to non-celiac related causes for whatever the symptoms there are. And then also maybe just make sure that generally we're thinking about nutritional deficiencies that can sometimes be associated with long-term celiac, or somebody who's had celiac for a while, and just make sure that none of those may or may not be contributing. Now, all of that said, I think that's kind of within the realm of either adult GI or a primary doctor who could sort of better pinpoint and get a sense as to kind of what is going on. I don't know if anybody else would add anything or has other thoughts about it, but.
Yeah, we did do a study many years ago when I was still in Chicago, looking at these are what we call extraintestinal manifestations of celiac, so things outside the gut. And we did look at rates of resolution or improvement of these symptoms in adults as compared to children. As a whole, children appear to be much more resilient and have response to the gluten-free diet and healing much quicker than adults, unfortunately, for adults. Good for children. On average, most of the patients that we looked at in the study for the children had pretty significant resolution of symptoms within 12 to 24 months. It did take longer for adults. And what we found was the longer the duration you had had the symptoms, the longer it seemed to take for those to get better. So if you've been suffering from this for a very, very long time, it may just be a longer process to get fully cleared of those symptoms. That being said, what we found is in somewhere between 20 and 30%, I don't quite remember the exact number, of patients that symptoms were not getting better on the gluten-free diet. It was not because of celiac, and it was because of another etiology. So I think talking to people is always a very good idea. Just like Dr. Kavari said, talk to your primary care, talk to your gastroenterologist you're seeing. I don't think there's ever any harm in getting a second opinion. So if you have a concern, I think seeing a neurologist and just making sure really nothing else is being missed is never a bad idea. But it is possible it's still related to the celiac, but if it's not improving the way you would hope or you have any concerns, then you definitely should seek out more advice. Please let us know if that answered the question for you, or if you have any additional questions we can answer about that. Great. Otherwise, we'll make our way down the list. And does anybody else on the celiac panel have any other thoughts or want to add anything else to that?
I think the one thing I would add, within our own team, I think we've all found great value in working really closely with the specialists available outside of our program. We work really closely with, dermatology, rheumatology. Our patients often see neurology, and that's been really valuable for us as medical providers. So if you have the opportunity to connect with another specialist and find out a little bit more about what's going on with you, it can be very valuable.
Thank you, Allison. Absolutely. All right. And if you have any more questions regarding the neurological symptoms, again, feel free to unmute or put in the chat. Otherwise, I'll move down to the next question. So this question states, curious about other issues that may present with celiac patients at a higher rate than those without celiac, such as OCD, depression, diabetes. I think that is a great question to turn over to Dr. Wren, actually.
Yeah, no, I'm happy to help answer that. I was thinking, Dr. Jericho, we can tag team this because I think of your research on extraintestinal manifestations, which you're just referencing. Well, do you want to share a little about your research and then I'll chime in because that might be a lovely segue. Is that okay?
Sure. Yeah, absolutely. So I think what Dr. Wren's getting at is some of the most common extraintestinal manifestations that we saw with potentially the worst rates of improvement are a lot of those psychological and psychiatric symptoms, such as depression, anxiety. Interestingly enough, prior to the diagnosis of celiac, it's thought to be related to the malabsorption of nutrients and nutrient deficiencies, poor weight gain. A lot of people talk about ADHD related to celiac. In reality, it's hard to prove one way or the other, but it's thought, again, it's those vitamin deficiencies, malabsorption that leads to a lot of those symptoms of just feeling poorly, like having a difficult time concentrating. And a lot of patients who go on the gluten-free diet, a lot of those symptoms get better. Unfortunately, the depression and anxiety that may have been related to nutrient deficiencies initially, unfortunately, we do see come back. And on the other end of that spectrum, it's often related to the social component of being on a gluten-free diet. And so maybe I'll turn it back to you, Dr. Wren, to talk more on that.
Absolutely, yeah. And I think with why Dr. Jericho's research is so great on this, of looking at extraintestinal manifestations generally, and can we put that link in the chat for people who are interested, or for specifically Noelle who asked about it. I think the research in pediatrics specifically, did show more improvement. So when children who did have higher rates of anxiety, depression is often what we see before diagnosis, after being on the diet, compared to adults, we did see those symptoms decrease, kind of get better over time, kind of over a 2-year period. And what Dr. Jericho is referencing is so important because even when, the intestines are healing, food is being, absorption is happening, inflammation is down, that explanation for psychiatric conditions like anxiety, depression improves as our gut heals. Living with a chronic condition as a kid or as an adult, but we work with kids and young adults here, is really challenging. And switching your whole lifestyle, staying adherent to a new diet, navigating new social situations where you can't eat what others are eating, or you need new food at school, or you can't get the food you had at school. All of these aspects can lead to increased levels of stress and psychological distress. So rates can sort of increase for other groups or continue to increase because that psychosocial element of living with a chronic condition. And so that's a huge part of my role. And we had a social worker, we will have another social worker, but a social worker's role is really supporting children, teens, young adults with the, living with and coping and supporting individuals who have celiac, and also really connecting to peers. And so that's a big thing that, as I've mentioned earlier, we've been really focused on, of how to support mental health while individuals are living a wonderful life, but coping with some really real challenges, and can be so helpful to be connected to a celiac community, is what our research has shown too. So let's see, I'll pause to see if anyone else wants to chime in on this. And I don't know, Hillary, if you want, I think the question also was other things like diabetes or other extraintestinal manifestations that might be helpful, or Dr. Kavari or Allison to share as well outside of the psychiatric.
I've been talking a lot, so if Dr. Kavari or Allison or anybody else would like to chime in, feel free.
Yeah, I was just going to add, I think this is a really good reminder of why in our clinical practice, we really try to see our teens and tweens one-on-one for a part of our visit to touch base on those things. Often lots of really great conversations happen in that part of the visit. So we really do try to prioritize that.
Absolutely. Thank you.
And then
Allison, Sorry.
No, go ahead, Anava, please.
I was going to say, you mentioned earlier our interdisciplinary clinic. So if we have families on who are part of our center or interested in our center, just this sort of fits that model very well of around a new diagnosis with celiac. We have a one-time clinic, which Allison references the interdisciplinary clinic, where you meet with a medical provider. So that would be Allison or Dr. Jericho or Dr. Gavari, myself, Farah, our dietitian, and our soon-to-be social worker, and we really look at a child and family holistically and how celiac impacts not only physical, like your physical body, but Noelle, to your question, the other aspects of life, mental health, school, all parts of functioning, and how we as a very holistic team, integrated team, can support a child and a family. And Nassim, with that, back to you.
No, I think you just said one of the things I was going to say, so that's perfect.
All right. And then I can chime in about the question of other what we call comorbidities, like other diseases that can be associated. So diabetes is probably the highest on the list. The genes that cause diabetes are the same genes that cause celiac. And because we see such high rates of celiac, and for whatever reason, we more often see the diabetes come out first and then the celiac disease. But because there are such high rates of celiac in our diabetic patients, most endocrinologists now do regularly screen the diabetes patients for celiac. For whatever reason, a lot of the diabetic patients I've seen really don't have a lot of GI symptoms. And it just goes to say, we've talked about neurological symptoms, we've talked about psychological symptoms. Really, celiac is its own entity, very different than anything else, and can present in so many different ways, from skin rashes to mouth sores to your typical GI symptoms to headaches, and I mean, you name it, to nothing at all. So if you are in a population that has higher risk for developing celiac, a lot of people will keep a closer eye on them. Some of those higher, the conditions that we see celiac more often in, again, are things like type 1 diabetes, not the type 2 as much, but the type 1. In adults, we don't see it so much in children, but multiple sclerosis is highly linked to celiac disease. And then the third one, highest up on the list, and there's many, many others, would be Down syndrome. So in those patients in particular, we do keep a very close eye on patients as a whole. Autoimmune conditions do seem to predispose you to other autoimmune conditions. So really, we would have a low threshold for checking for celiac if someone had concerning symptoms with another autoimmune or even without any of those. The other category, and it's not a disease per se, is first-degree relatives. And so there's a very high rate of celiac disease in first-degree relatives. What that means is for the person who's affected, their parents, their siblings, and one day their children are all first-degree relatives. And obviously those individuals share more genes with that person with celiac than anybody else. And the rates of first-degree relatives developing celiac is thought to be potentially 15% or higher. The risk of the general population is 1%. So that's quite a bit higher. So the other people we recommend getting frequent screening are those first-degree relatives, whether they have symptoms or not. I don't know, Dr. Kavari or anybody else on the call, if you want to add anything more to that.
I might just say, agree with everything. And I think that's just one of the reasons why follow-up is really important. Sometimes I think people are like, oh, I'm on a gluten-free diet, I feel great. And then there's not that follow-up, whereas in our clinic visits, we're usually pretty mindful about asking the questions that would help screen for some of those things too. So that's why we like to see people, even when they're feeling great, just to make sure we're not missing anything else.
Absolutely. And Dr. Kavari, you want to talk more, or Allison, or anyone else on the call, about what is the time frame for what we call frequent screening for siblings or parents, children?
Yeah. Allison, would you like to respond to that one?
Sure. I think that there's some flexibility in the thought around how frequent screenings need to be. I think generally we would screen siblings when their other sibling has first been diagnosed, and then maybe every 2 years, or if symptoms come up, then you would have a lower threshold for rescreening. And then I don't know if Dr. Jericho, you want to talk about the value of genetic testing?
Oh, sure, absolutely. And like Allison saying, and it's something, I'm part of what we call NASPGHAN. This is a mouthful. It's the North American Society for Pediatric gastroenterology, hepatology, and nutrition, NASPGHAN. And I'm part of the celiac committee for that. And our guidelines are pretty old, and we are working on new guidelines. There is absolutely no set definition of what that frequent screening means. And it probably, if you ask 10 different gastroenterologists, they're going to give you 10 different answers. And it's just our personal style. The person I trained with, we did every 3 years, just like Allison said. Certainly any concerning symptoms we would do sooner, but you screen everybody at the diagnosis of the affected individual. I have people in other centers that I work closely with who will just screen every year because it's easier to not forget. So there's no absolute guideline. The key is just consistency. And like one of the participants on the call said, she was diagnosed when she was 59. We can see this. The youngest patient I've ever had was 10 months old. So from the second you eat gluten to the second you leave this world, you can get diagnosed with celiac. So really the bottom line is just ensuring there's some cyclical time frame that you're keeping an eye on it to make sure it's not missed.
And I think this was sort of implied in what both Allison and Hillary said, but a lot of people don't have symptoms. So that's why there's like screening for symptoms, and then there's screening for people who might just be at risk for celiac. So that would be sort of like the people who might have type 1 diabetes, people who are first degree family members, people who have certain thyroid issues, just to name a few. And then there's some other kind of less common genetic syndromes and other things like that we also do screening for, kind of independent of any symptoms that are going on.
Absolutely. Perfect. Thank you so much for clarifying. And then just to pick up the other piece that Allison was bringing up is the genetics. And so there is a lot of confusion around the genetics. Luckily, insurance these days tends to cover it. If they don't cover it, it's not as expensive as some genetic testing. It tends to be a couple $100s versus a couple $1,000s. And like I said, I haven't really had a problem with insurance covering it in many, many years. The misconception about the genetics, though, is that if you have the genes, you will develop celiac, and that is absolutely 100% not true. And it's something I, time and time again, need to clarify to people. It's a very confusing topic. So about 40% of the world have the genes that cause celiac disease, but only 1% of that population, of the world's population, will go on to develop celiac. So we will often get the genetics not to prove that someone has celiac, but more to actually rule them out. So if you don't have the genes, you cannot develop celiac disease. So a lot of times with those first degree family members, it's really helpful to get the genes, because if any of those people don't have the genes, they never have to get screened ever again. The likelihood of them having celiac, while you can't ever say 100% for anything, but it is exceptionally low and probably as close to 0% as you can get without saying 0%. So that is really the reason for the genes, is to help to rule people out of the possibility of celiac, not to rule them in. And I don't know if anybody else wants to elaborate that further. Okay. I don't see any more questions in the chat. So for the next handful of minutes, I might go through a little more of these true false questions just to see.
Hillary, if it's okay.
Yes, Leah, please.
Okay, so I got a direct message. So this person would prefer to stay private, but so I got permission to ask. Somebody is out of the area and would like to visit Stanford, and their doctor is not letting them know or understand the correlation between celiac and thyroid, a low thyroid condition. And that's just interesting too, because I myself have hypothyroidism, so very, very low thyroid, and have been on medication since I was 16. So from what I was told, since hypothyroidism, and please tell me if I'm wrong, that hypothyroidism is an autoimmune disease, obviously, so is celiac. And once you have one autoimmune disorder, is it easy to get another one? And how in the future can this person that is out of the area wants to visit Stanford, what can that person do?
I'll open up to other people in the panel to chime in first.
So as I think, as you just mentioned so beautifully, Leah, that's right. So both celiac and thyroid are autoimmune conditions, and probably some of the same genes that we see specifically in celiac are also in other autoimmune diseases, such as thyroid. We think around up to 5% of people with celiac might also have some other autoimmune thyroid-related diseases. And so that's one of the reasons why, at least in the pediatric population, we do quite a bit of screening. Sometimes adult medicine doesn't do as much screening, I think, as pediatric does. We tend to do a little bit, maybe more hand-holding or be a little bit stricter about guidelines. And so that might be kind of one of the reasons why we're seeing some of those differences. And then I guess maybe the other thing I'll share is sometimes there can be kind of overlap of symptoms between celiac and thyroid, which also can make things just a little bit confusing. So I guess that's the sort of celiac thyroid relationship that I would think about, or at least some of it. And then I might defer to others about the visiting question because I'm not totally sure about the practicalities of that one.
So I could try to chime in. Dr. Rosen, I feel like you might know the best.
I mean, we can put number, so, we're happy to see patients, generally if they're new patients, they'd be under 18 in our pediatric practice, generally if they're new patients. And we can provide the link for Stanford adult GI practice as well in the chat. I can get that up there. I think if you're in the state of California, then telehealth can be an option. If you're not in the state of California, unfortunately, state laws don't allow us to see patients. State licensing laws don't allow us to see patients by telehealth in another state anymore. There were some easing of those restrictions in the height of the pandemic, but most states have gone back to the original standards. So yeah, I can certainly put some links in the chat, but certainly us on the pediatric side are happy to see folks in consultation or for continuing care. It's what we like to do to take care of children with celiac disease and inflammatory bowel disease. Thank you, Caroline.
I think Caroline just put that in. Wonderful. Yeah. So Caroline just added the link to the adult program. All right. And Leah, any more messages that were sent to you, or anybody want to put things in the chat? Otherwise, like I said, I might go back to one or two of our additional true false to end the hour out.
That's all that I saw.
Okay. All right. So I'm going to switch gears actually and talk about one of our research team individuals, and then maybe that'll stimulate if anybody has any questions about the research side of things, how our research studies are how they, what's the word I'm looking for, not unfold, but the methods behind them, or the studies that we're doing right now. So I'm going to talk about Marielle Gibson. So Marielle was chosen as our inaugural biorepository manager, as you heard before, for her exceptional ability to ensure accurate handling and proper storage of our biospecimens. Her diverse background as a first responder, pilot, and glider, soaring over Canada's stunning landscapes, equips her perfectly to tackle the challenges of maintaining the biorepository's success. So what do people think? Do you think that's true or false? You can put it in the chat. Let's see. All right, we got a true. Got another true. Just two responses. Mostly true, except for the glider. I don't know, but I want it to be true. False, false. Mostly, we got that true. Let's see, anybody else want to contribute? True question mark. False, the glider part switch out. Excellent swimmer. I love it. All right, Marielle, you want to share whether this is true or false?
So it is true. And you could also add the part about being an excellent swimmer. That would also, you can put that in there. I do have my pilot's license as well as my glider pilot's license. And I've been thinking about if I can start back up flying in California. There's lots of gliding. Yeah, thank you. Yes, it was when I was younger, I was in the Air Cadets when I was back in Canada. And so I had the opportunity to get my licenses. And this kind of, usually that's my, nobody knows, but that's my like cool fact. But I do
Some
feel
people
like
know.
some people know. Some people spill the beans on me. I do feel like you know, having like all of the multitasking, sometimes when you're flying, you're in a high pressure situation. I do feel like all of those have prepared me for just being level-headed and being able to take things as, you know, assess situations as they come up and to be able to problem sort. So yeah, Ashley, thank you. Yeah, I can fly through Stanford Moffett Field maybe one day. So yeah, I would like to get back into flying. So thank you for sharing that fun fact about me. And if anyone has questions about the research too, you know, shoot a
Exactly.
question about the research. So
I'll give everyone a couple of minutes in our audience to see if anyone has questions, and then I'll wrap it up with one final true false question, and then we'll say goodbye for the night.
yeah, I could take it just a second to, you know, do a little promotion for the biorepository again.
Absolutely. Go for it.
If anyone is a pediatric patient with one of like the digestive conditions that we are looking into, they can become enrolled in our biorepository where we would collect samples alongside routine care, and these samples go to our researchers, like Dr. Rosen said, to make organoids or to look at blood markers. We also collect microbiome samples, which we are really trying to spearhead, and that one you receive a $20 incentive for completing a stool kit. So if anyone is interested. Oh, Ashley had a question. Yes, siblings and parents. We are also recruiting parents and siblings to do microbiome stool kits. So yes, thank you, Picha. Email us. We would love to hear from you. And yes, we're looking to expand specifically our stool kit collections to include family members as well, to help you know, paint a broader picture of what's going on with the microbiome. So that's all I have to say.
Thank you. All right, I'm going to end with one more true false if I don't see any questions in the chat, and then thank you all for participating for the night. So we're going to switch gears one more time and come back to someone who's been a huge part of this conversation tonight, Dr. Wren. So her true false statement. After an unforgettable college horseback riding trip in the beautiful Altai Mountains, she, a lifelong equestrian or horseback rider, found a sense of peace that motivated her to transition from riding horses to becoming a psychologist. Is this true or false? We got a true maybe, true maybe, false maybe, true. This, what did that say? This fam true? I could totally see riding horses. True. A lot of truths here. All right.
I keep like a
Awesome.
really good poker face, but it's really hard. I keep smiling.
Go ahead, Anava. Take it away. Is this true or false?
It's so most definitely false. I wish I could ride horses. It sounds like everyone thinks I could ride horses. So I feel like you guys are really like giving me some motivation to maybe go get on a horse. I have done some horseback riding on vacations. I will maybe 5 times total in my life. That is all.
Do you want to quickly share your inspiration for becoming a psychologist?
My inspiration, yeah, sure. I actually studied neuroscience in college, so I was always really interested in the brain and kind of the brain and body connection. And a lot of my work was around integrative medicine, so mindfulness and yoga-based strategies sort of manage symptoms, like pain symptoms and other physical symptoms of chronic conditions. And through that work, I realized I really did not like rats or labs in the way. And I would try to bribe my friends in college to give my rats injections for the different research. So I thought it was my sign that like I was not made for research, like basic science research. And I was always loved working with people in just the jobs that I did as a kiddo and camps, and realized my interest in neuroscience was much more clinical. So that led me to clinical psychology. Yeah, and integrative medicine, more clinical as well.
Beautiful. Well, thank you for sharing. All right. Well, we will wrap up this session. If, again, we've added to the chat the different email addresses. If anybody has more questions or is interested in research, please reach out anytime. We're happy to answer any additional questions through email as well. And thank you for joining us tonight. We appreciate your support. And we'll all log off. Take care. Have a good evening.